Hi, this is Dr. Munyon at Exotic Vet Care, and me and my assistant Peridot are going to show you how to do injections in a snake. And this is something we do very, very commonly, usually because of some sort of infection, upper respiratory or skin. It could also be for cardiac issues, chronic pain. In general, injections are much better absorbed into snakes and much easier to administer than oral medications. So first off, you're going to have your medicine already drawn up and ready to go. And then you will get your little snake friend who is trying to go hide someplace. And when we're doing injections in snakes, we want to do it in the front half of the body to avoid interference with the kidney. So front half of the snake. And then take the portion that you want to do the injection in. I don't recommend going too close to the head, so kind of this meatier area back here. And have a good grip of your snake. So that the portion you're going to inject isn't moving. So the rest of them can move around and you're not holding near the head where it might make them jump and be shy. And then the injection itself is going to go here. Here we have a diagram of reptile skin. This area up here is the skin with the scales coming off. Down here is the muscle layer, and in between is the subcu space. And depending on the type of injection, you'll be asked either to introduce your needle in between the scales. That was not very good, between the scales, there we go. Into this space here, or deeper into the muscle. Now that we know where we're going to try to do this looser area kind of at the border of the body scales and the belly scales, because there's a little more space here, and if you go up here, their muscles can actually contract and push your injection back out, which is not helpful. Then you take your injection, you go between the scales and kind of pop in. Make sure the beveled side is up. You draw back and make sure you have negative pressure. If you get blood or air back, just pull out and pick a different spot. But once you get your negative pressure, you go ahead and administer your injection. Twist your syringe a little bit to help, as you pull out, to help tighten up the skin and close it. And you can put your finger over the injection site, because there might be a little bit of leakage that's completely normal. And then your injection is done. Ideally, you try to alternate spots for injections so that you're not hitting the same spot.